Assalamu alaikum. Welcome back to my channel. Today we study pericardium disease step by step. When the heart speaks, the pericardium whispers, but when the heart strikes, that whispers become a warning. Welcome to this clinical journey through the pericardial sac, a space small in size but massive in clinical importance. In this first part of our video series, we will explore the anatomy, function, and crucial role of the pericardium plays in maintaining cardiac integrity. Let's begin at the very foundation what the pericardium is, what it does, and why understanding it could make the difference between the life and anatomy of the pericardium consists of two layers. The visceral pericardium, as you see in the video, the upper portion, and the parietal pericardium, which is thicker fibrous sacs surrounding the heart, although it is often the parietal pericardium that is typically referred to as the pericardium, as you seen is the lower side, and the center and the mid of the visceral and the parietal layer there is a pericardial effusion you are seeing. It should be emphasized that the most disease state simultaneously involves both the parietal and visceral pericardium. Normally there is 5 to 10 milliliter of normal buffering fluid within the pericardium space. The pericardium encases all four chambers of the heart and extends 1 to 2 cm up the great vessels. The pericardium restrains the four cardiac chambers within a relatively confined volume and space within the thorax. Because of the pericardium constraints, the total volume of the four cardiac chambers is limited, and the alterations in the volume of one chambers must be necessity be reflected in an opposite change in volume of the another chambers. This linking of intracardiac volume and the underlying pathophysiology of developments of pulses paradoxes and the findings seen as a cardiac tamponade and pericardial constriction. Pericardial disease can present as several clinical scenarios, and for each of these echocardiography plays a significant role. Pericardial effusion can accumulate in any infectious and inflammatory process invading the pericardium. Most infectious and inflammatory processes involve both layers of the pericardium. Acute pericarditis of any etiology may result in accumulations of variable amounts of pericardial fluid. In early phases, inflammation may be present in the absence of any significant accumulations of pericardial fluid. It is important to evaluate left ventricular function in patients presenting with suspected acute pericarditis to exclude a component of myocarditis. Because the pericardial space is limited in size, accumulation of significant pericardial fluid reduces the total amount of volume the four cardiac chambers can contain and may result in hemodynamic deteriorations related to effective underfilling of the ventricles. It should be recognized that hemodynamics compromise is related to accelerated intrapericardial pressures, which is which in turn is related to the volume of pericardial fluid of the compliance or distensibility of the pericardium. As such as a slowly developing large effusion may be associated with less hemodynamic compromise than a smaller but more rapidly developing effusion. Acute inflammatory process of the pericardium typically result in pain and fluid accumulation, and more chronically can result in fibrous threading and stepping of the pericardium. As you see the fibrous threading, the bridging in between the parietal and the visceral layers. Thickening of the pericardium eventually can lead to pericardial constriction. Other types of pericardial pathologies such as pericardial cyst and congenital absence of the pericardium are often noted as incidentally finding asymptomatic individuals. The pericardium, once seen as a simple covering, it is now known to be a dynamic player in cardiac function and pathology. This was just the beginning. In the next part of this series, we will move into the detections and quantifications of pericardial effusions, the differentiations between pericardial and pleural effusions, and the life-threatening condition of cardiac tamponade and pericardial constrictions, constrictive pericarditis, with echocardiography images. Don't miss it because it's sometimes the key to saving a heart lies just outside of it. If you passionate about echocardiography and real cardiac cases, subscribe and stay tuned with me. Let's learn together, one heartbeat at a time.